Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, primary glaucoma. Right. Primary glaucoma can be open angle glaucoma or it can be closed angle glaucoma. Okay. First, or closed angle glaucoma. First, open angle glaucoma. In the open angle glaucoma, again it can be primary open angle glaucoma. There can be primary open angle glaucoma or there can be normal tension glaucoma. Then we have ocular hypertension. So what is the differences between primary open angle glaucoma, normal tension glaucoma and ocular hypertension? In primary open angle glaucoma, it is an actual glaucoma where you see presence of the high intraocular pressure is seen along with the visual field changes and optic disc changes are seen. High intraocular pressure, visual field changes and optic disc changes are seen in primary open angle glaucoma. In normal tension, the tension is normal. So intraocular pressure is normal in normal tension glaucoma, whereas the visual field and optic disc changes are present in the normal tension glaucoma. Only the intraocular pressure is normal, but optic disc changes and also the visual field is also seen in visual field changes are also seen in normal tension glaucoma. Then in ocular hypertension, the intraocular pressure is high, whereas the rest of the visual field and optic disc changes are normal. Then we have closed angle glaucoma. Closed angle glaucoma is again divided into primary angle closure glaucoma or there is primary angle closure. First primary angle closure suspect, then we have primary angle closure, then we have primary angle closure glaucoma. In primary angle closure suspect, here we are actually suspecting that there is glaucoma is present. It is not yet manifested. So in this case, all of the three, that is intraocular pressure, visual field and optic disc are completely normal. Whereas in primary angle closure glaucoma, here the intraocular pressure is high. It is the starting stage. So intraocular pressure is high, whereas visual field and optic disc are normal. Whereas in primary angle closure glaucoma, all of them are seen. That is intraocular pressure is high, visual field changes and optic disc changes are also present in closed angle glaucoma.
thank you and thank you for watching.